Hello, I'm Dr. Kiesslich from Germany. I'd like to present you a new study about confocal laser endomicroscopy. The study is about the in vivo diagnosis of Barrett's esophagus-related neoplasia. And the study was a multicenter, international, randomized controlled trial. The study was performed at different centers in the United States as well as in one center in Germany. The background is that confocal laser endomicroscopy enables in vivo microscopic imaging of the GI tract. However, there are still limited data on endoscope-based confocal laser endomicroscopy for imaging Barrett's esophagus and for immediate decision to diagnose Barrett's associated neoplasia. We randomized patients in a 1-to-1 ratio towards high-definition white light endoscopy with random biopsies, or the second group was about high-definition white light endoscopy combined with confocal laser endomicroscopy, and targeted biopsies were obtained. Real-time diagnosis was made and management plans were recorded after high-definition white light endoscopy in both groups, as well after confocal laser endomicroscopy in group 2. Gold standard was the blinded expert pathology which diagnosed the reference standard. A total of 192 patients were finally included in the study. In group 1, 98 patients, and in group 2, 94 patients. There were no significant differences between the patient characteristics comparing group 1 and group 2. Main outcome of the studies was first that the number of biopsies could significantly reduce. 580 biopsies were needed in group 1 and this could be reduced to 190. In patients with Barrett's associated neoplasia, 297 biopsies were needed in the random approach, whereas only 77 biopsies were needed in case of endomicroscopy was used to diagnose those changes. The second main outcome was the diagnostic yield, and here you see the per patient analysis. For all patients, the yield could be increased from 6% to 22%, whereas for neoplasia, it could be increased from 22% up to 75%. If you look on the performance characteristics, you see that the sensitivity could be highly increased from only 10% using random biopsies protocol towards 86% by using confocal laser endomicroscopy. Furthermore, in the per patient analysis, sensitivity of 95% and specificity of 92% could be achieved. In experienced hand, the sensitivity was even 100%, and experienced hands means that those investigators or examiners did perform more than 200 endomicroscopic examinations prior starting the study. In conclusion, real-time endomicroscopy and targeted biopsies after high-definition white light endoscopy can improve the diagnostic yield and accuracy for neoplasia and significantly impact in vivo decision-making by altering the diagnosis and guiding therapy.